As yet, there is no cure for asthma, but it can be controlled in most patients with good medical care. Dr. Clare-Dimaunahan of Children's Hospital of Orange County discusses the causes as well as treatments, helping people to live with asthma.
Asthma can present also in the infancy period. It can present with wheezing or a lot of chest congestion, but a lot of times we see it in the school-aged kids. Most of the time you can grow out of the symptoms of asthma, but it does depend on how severe your asthma was as a kid. Family history does play a big part in asthma. If your mother or some other members of your family have asthma, you are more likely to have asthma as well. Asthma has different severities. There's mild intermittent, there's mild persistent, moderate persistent, and severe persistent. So it depends on how many times you have symptoms throughout the week or throughout the month. If you have less than 2 coughing episodes or wheezing symptoms per week, then you are in the intermittent category. If you have more than 2 per week or more than 2 nighttime symptoms per month, then you're in the persistent category. Asthma has different components. One is airways inflammation. The second one can be mucus production. And the third one is airways obstruction, which is reversible. Those would be the components of asthma. One of the ways we diagnose asthma is through a pulmonary function test and their response to a bronchodilator. If their asthma is in the intermittent category, we recommend having a bronchodilator, otherwise known as albuterol or Xopenex, and that is as a rescue. But if they're in the persistent category and they're needing albuterol inhaler more than 3 times per week or more than 3 times per month, we recommend starting them on a controller medication, which is an inhaled corticosteroid. If they're intermittent category, sometimes we see them every 3 to 6 months, but if they're in the persistent category, we like to see them at least every 2 to 3 months to make sure that their asthma is under good control and that they are compliant with their medications. As pulmonologists, we recommend that kids with asthma do all the activities that a kid without asthma has. We recommend to do the bronchodilator or albuterol inhaler 15-20 minutes prior to them doing any physical activity or PE, so that way when they're running and doing activity, their airways are already open and therefore they can run and do sports and things like that. Sometimes the symptoms clear up in adulthood. Other times, which is less often, the asthma can lead to chronic obstructive pulmonary disease, and that's when it's in this more severe category.